Hello, good morning and welcome. I'm Ojong Wisdom on behalf of Global Body Goals. In our last episode, we defined obesity and said that it has a direct link to cancer and that fitness has a role in mitigating this challenge. Now, in this second episode, we will go further in explaining one of the types of cancers that is directly linked to obesity, and then we will talk further on how fitness has a direct impact in addressing this challenge. So, the first cancer on our list is endometrial cancer. This is the cancer of the uterine lining and is the most common gynecological cancer in the world today. There are several risk factors, such as obesity, where adipose tissues convert androgens to estrogens, therefore increasing the promoting endometrial thickening. Then there's hormonal imbalance, where there's a prolonged estrogen exposure, such as estrogen therapy. Then there is metabolic conditions such as diabetes, hypertension, insulin resistance. Then finally, there's early reproduction and genetics. You see, these factors increases your chances of having endometrial cancers. Now we're going to go into the symptoms of so that you can know if you have these symptoms, then you can know that you have a higher chance of having endometrial cancers, and then we know how we can start to mitigate it. Some of the symptoms include postmenopausal or irregular VJ bleeding, pelvic pains, pain during intimacy with your partner, or watery or bloody discharge. Now, if you have these symptoms, I would suggest you go for a diagnosis. And one of the diagnosis you can do is endometrial biopsy, DNC, or trans VJ ultrasound. Now, this diagnosis will tell you exactly what's wrong with you if you have endometrial cancer. And then now the best treatment is hysterectomy. Now, it is actually combined with radiation or chemotherapy for advanced stages. So, now let's talk about the role of fitness. Let's start with prevention. Fitness helps with weight management. It reduces obesity driven estrogen production. It helps with hormonal regulation, lowers estrogen circulation, and improves insulin sensitivity, thereby mitigating insulin resistance in the body. Let's talk about fitness as a recovery tool. Fitness enhances recovery, it improves physical functionality of the body, it boosts mental health, and also studies suggest that patients who indulge in physical fitness activities have a lower chance of reoccurrence of endometrial cancer. So here are some recommendations for exercise activities. So it's recommended that 150 minutes per week of moderate physical activity, exercise like brisk walking is enough for an individual. And also, I strongly recommend that exercises are tailored to individuals' capacity. So if you happen to be at the gym to exercise, for example, you have to inform the trainers that this is your challenge and they have to give you the timed exercise. Most importantly, in conclusion, fitness is a tool to mitigate. It is not a curative tool, just a management tool. So it's strongly recommended that you consult your health professionals to undergo proper diagnosis and treatment, then use exercise as a means for recovery. Stay tuned to watch out for our next episode where we talk about the second type of cancer and we analyze it more. Have a wonderful day from Global Body Goals. Thank you so much for watching.